today. Sorry. Okay. So, my friends and all doctors, okay, who are preparing for MCS, good news for you that I have made my time to upload the third video. Okay, so let's continue. Okay. Sorry. Internal jugular vein, most preferred veins for CVS in operating room. Subclavian vein is most preferred veins outside operating room. Femoral vein in acutely injured and critically ill patients. Tumor but cut. Staging is mesothelioma. Hereditary papillary RCC is MET medicine. 7Q location. Lee Fraumani SP53 Zin 17Q location. Carcinoma penis is inguinal lymph nodes. Carcinoma testis on right internal aortocaval lymph node, on left para-aortic lymph nodes. Carcinoma bladder is obturator lymph node. Carcinoma prostate obturator lymph node. Important lymph node. Sister Mary Joseph nodes, periumbilical meta. And let me see what is written it. Cutaneous, maybe. Okay, because I have written myself, but right now I've forgotten as it's a shortcut, like just a half word is written. Rotor's node, internal pectoral nodes, carcinoma breast, Rovier's nodes, retropharyngeal nodes, carcinoma nasopharynx, Delphian nodes, precricoid tracheal laryngeal lymph node, iris nodes, nodes in left axilla, carcinoma stomach. Supine, film signs of pneumoperitoneum, football sign, collection of air in the center of abdomen over a fluid collection, regular sign, visualization of both aspects of bowel wall being outlined by air on either side. Cupola sign, large amount of gas under diaphragm. Triangle sign, air between bowel loop. Investigation of choice, acute mesenteric ischemia, angiography, mesenteric venous thrombosis, CECT, chronic mesenteric ischemia, aortography. Gastrointestinal tuberculosis, most common abnormality is increased ESR. Complication of enteric fever, paralytic ileus, MC, most common. Intestinal hemorrhage, perforation, cholecystitis, phlebitis, genitourinary inflammation, arthritis, osteomyelitis, carcinoid tumors, bronchus more than ileum is more than rectum is more than appendix is more than colon is more than stomach. Most common site of carcinoid tumor, the tract is more than respiratory tract. Neck, carotid, let me see. Body tumor, chemodectoma. Turner syndrome is associated with cystic hygroma, Jacquard striate ipsilateral ophthalmoplegia plus amaurosis plus ipsilateral neuralgia. Post-displacement of alar cartilages unilateral cleft lip. Shock is a clinical syndrome resulting from inadequate tissue perfusion. Most common cause of death in surgery, but tart. Staging mesothelioma, Novus C classification, adenocarcinoma lung, Sister Mary Joseph, parumbilical, metastatic cutaneous nodules. Rectal appearance is seen in achalasia. Sunitinib are probed for advanced renal cancer and refractory metastatic breast cancer. Most common soft tissue tumors in infants and children, rhabdomas are common. Widest portion of colon is cecum, narrowest portion sigmoid. In case laxative abuse, ammonium urate, renal tubular acidosis, calcium phosphate. Cholangitis E. coli is more than Klebsiella. Blood stained breast, duct papilloma, serious fibrocystic disease. Rails tube making. Rails tube marking. At 40 centimeter indicates level of G junction. At 50 centimeter indicates body level of body of stomach. At 60 centimeter indicates level of pylorus. At 65 centimeter indicates the level of duodenum. Indication of Rails tube insertion, diagnostic and therapeutic. Saline low test is confined gastric outlet obstruction to access free total acid in peptic ulcer to diagnose tracheoesophageal fistula and in Hollander's taste for completion of vagotomy. And therapeutic decompression in intestinal obstruction in perforation peritonitis, aprasia blade, abdominal surgeries, enteral nutrition in head injuries, comatose patients, maxillofacial injuries. Paraneoplastic syndrome in SCC, hypercholesterolemia, MC is more than glucose, hypoglycemia, erythrocytosis, and hypercalcemia. Hemangioma, most common hepatic abnormality, SCC. Treatment is organ transplantation, SCC derived blood supply from hepatic artery, echogenic cancer, neuroendocrine tumor, colonic carcinoma, choriocarcinoma, RCC, multifocal SCC, echo for SBPL, breast carcinoma, pancreas carcinoma, lung carcinoma, lymphoma. Indication of POLT is one reversible fulminant hepatic failure, small for size grafts, non-cirrhotic liver disease, ABO incompatibility, 5 sequential anastomosis of OLT, SIPSB, suprahepatic IVCs, infrahepatic IVC. That is 1 and 2, and third is portal vein, 4 is hepatic artery, and 5 is bile duct. Connotes classification: quadrate lobe 1, left lobe 2, 3, 4, right lobe 5, 6, 7, and 8. Indirect conjugated hyperbilirubinemia is treatment rifampicin, ribavirin, probenecid. Inherited condition is Crigler Nasser and Gilbert syndrome. Direct conjugated Dubin Johnson syndrome, Rotor syndrome. Modified Johnson's classification of GU. So type, location, and then is acid secretion. One, lesser curvature near insula angularis, and acid secretion low. 2, body of stomach and duodenum high. 3, prepyloric within 2 to 3 centimeter of pylorus high. 4, high on lesser curve near Z junction low. And 5 is anyway induced by medication size low. Tumor markers CA, CA19, 9, CA125, CA72, 4. Beta SCC, most common site of stomach. Metastasis is liver, more than lung, is more than bone. Carnitроid, gastric carcinoma, paraganglioma, pulmonary chordoma. Okay. Single bubble sign is congenital hypertrophic pyloric stenosis. Double bubble sign duodenal atresia, annular pancreas. Triple bubble sign is jejunal atresia. Pediatric tumors. Most common malignant tumor in infant. Most common extracranial tumor in children. The most common abdominal Malignancy in children is neuroblastoma. Most common primary malignant renal tumor of childhood is Wilms tumor. Most common renal tumor of infancy is congestive mesoblasthic nephroma. Most common soft tissue tumor in infants and children is rhabdomyosarcoma. Most common solid tumor of children is brain tumor. Most common cancer of childhood leukemia 30% more than brain tumors 22%. Most common lymph nodes involved is carcinoma penis, inguinal lymph nodes, carcinoma testis, right internal or caval lymph node, left parietic lymph node, carcinoma bladder, carcinoma prostate, obturator lymph nodes, embolic occlusion, leg, pain, pallor, paresis, pulselessness, paresthesia, brain, TIA or a stroke, retina, amaurosis, fugax, and mesenteric vessels, gangrene, spleen, local pain, kidney, loin pain, and hematuria. Alvarado. Alvarado mental store manifestation is correctly. The symptoms migratory RIF pain 1, anorexia 1, nausea and vomiting 1, signs tenderness RIF 2, rebound tenderness 1, elevated temperature 1, laboratory leukocytosis 2, shift to left 1. Okay, now is total is 10, yeah. 9 to 10 appendicitis is for certain. 5 to 6 is equivocal. Okay, 7 to 8 is high likely of appendicitis. 1 to 4 appendicitis is ruled out. So when the score is 1 to 4, no appendicitis. 5 to 6 equivocal. 7 to 8 high likelihood of appendicitis. And if the score is 9 to 10, appendicitis is for sure. Gibbons hernia with hydrocele, very important. Burger's hernia into pals of Douglas, Baclar's hernia, femoral hernia through opening of venous vein, and amines hernia, inguinal hernia containing appendix. Lymph node metastasis, Roter's node, internal pectoral nodes, carcinoma breast, Rovier nodes, retropharyngeal nodes, carcinoma nasopharynx, Delphian nodes, precricoid, pretracheal, prelaryngeal lymph nodes, iris nodes, nodes in left axilla, carcinoma stomach, cystomeral Joseph nodes, periumbilical metastatic cutaneous nodules, Versus nodes, left supraclavicular nodes, cloacate nodes, femoral canal node, lymph node of LUNT, cystic lymph nodes, Krauss lymph nodes, jugular fossa lymph nodes. Treatment of tumor lysis syndrome is hydration, allopurinol, rusburicase, and hemodialysis. Okay, risk factors for oral cavity cancer: tobacco, alcohol, arecanut, palm mistela. Sharp jagged tooth, ill-fitting dentures, poor nutrition, syphilitic glossitis, HPV, EBV, Plumbers-Wilson syndrome. Restricted mouth opening can be treated with intralesional steroids, surgical excision, and skin grafts. Most common gene mutated in oral cavity, carcinoma, P53, SCC. Most common pattern of spread is local extension, regional lymphadenitis. Lymph node metastasis most common in carcinoma lung. Hard palate is more than a lip. Most common site of metastasis of lung. Sinonasal cancer is common in people working hardwood furniture industry, leather work, and manufacture of mustard gas. Aphthous stomatitis is also known as Sutton's disease. Aphthous ulcer, minor ulceration 3 to 10 mm, and major ulceration size more than 10 mm. Herpetiform uncertain 1 to 3 mm. Okay, and the remaining portion is cut, my gosh. What that form clusters, something like that, is written. So we have already finished 10 notes. today. Okay, so altogether that is 30 or 31. uh, I counted it. It was about 31 according to my calculations, so there will be a little more or less. Okay, my friends, so we have finished 10 slides or 10 pieces of papers known in very short time today. So review it, and when we listen to it several times, it will be fixed in our mind, and there are the keys from the book. So they are going to help you, all my doctor friends. So have a good day, and see you in the next video. Thank you very much.